Hi, my name is Shalay Lawson. I'm an FTCC nursing student. I'd like to welcome everyone today, and we will be talking about time management and professionalism as it relates to a nursing scenario. So let's get started with the scenario. So the takeaway from this whole assignment is that the learner should be able to state tips on how to delegate work. The learner will be able to better prioritize and manage their schedule. The learner will be able to organize their shift based on materials learned, and the learner will be able to state how professionalism and management work together. Okay, so let's get started with the scenario. Bear with me because the scenario is a little lengthy. But once again, this is from if I was a charge nurse for the day. So say you were a charge nurse for a day on your unit. The unit is a step-down med-surg unit with telemetry, capabilities, ventilators, and lower oxygen delivery systems, and some critical IV drips. The unit can hold 25 clients at maximum capacity, but currently the crisis is low with only 8 clients admitted. The workload is usually heavy as these clients are usually only moderately stable and require many care tasks daily. You are, meaning me, the charge nurse for the day and need to organize the staff in the best way to get everything done for the day safe and effectively. How would you go about organizing the staff? Okay, so let's go and see what our staff members or who our staff members are, as well as who our clients are. Okay, guys, so now we're about to go through the 8 patients that we have. And I'm going to give you guys time to read it on your own, and basically it presents the patient's age and their gender, as well as the current issues that are going on at the moment, current diagnoses, as well as other diagnoses that they had or have. Their current vitals are also presented, as well as their current orders. So take some time to read through that, and then we'll continue with the presentation on how professionalism and time management kind of tie together in these scenarios. Okay, and these are patients continued. I think patients 3 through 4 are on here. Okay, some more patients. Patients 5 through 6 are on here. All right, then our last bit of patients, patients 7 through 8. There are the last bit of patients that are on here. And then we'll continue with the presentation. Okay, now we're going to talk about how basically I divided up the patients or the clients between the staff members. So I had 4 nurses, basically, 1 LPN that could give care over a patient. So I gave myself Jeffro and Jenny, and as you read their conditions, you can probably see why they seemed. Everybody in this scenario is critical in a sense, like they could go from being good to bad in a matter of seconds. But these 2 patients right now I felt were a little bit overlooked in what was going on with them. Jenny, you'll see why. We'll talk about it a little bit later on the issues that she had that I felt like weren't addressed, and that she was getting worse with her condition, especially Jeffro as well with his oxygenation. That's very important, especially if he's come from the ICU the night before. He needs to be taken care of and really paid attention to. Then for my next graduate nurse, Pat, he just graduated, so he only has like a year of experience in nursing. This is his first nursing job, and he also just completed orientation last week. So I tried to give him the least issued patients, like maybe patients that he would just have to monitor to allow him to be able to care for them fully without really anyone needing to step in to help him, because he should be like basic kind of skills that he had to do in orientation. But also, I'm charge nurse, so I'm definitely going to be going and checking behind him and helping him out in any way I can. So that's why I basically gave him the 2 patients he had. Logan, my LPN nurse, he has 20 years experience, very experienced, 20 years, 10 years on our floor. So I would have given him the most intense patients I could give him for his scope of practice. So basically, so he wouldn't have to be under an RN supervision necessarily, but he can do everything that needs to be done, and it's all within his scope of practice. So that's the patients I try to gear and focus on giving him. Alex, he is experienced as well, 15 years, 12 years in labor delivery, but only 3 years on our floor, which is still good. So I kind of gave him the patients behind me. So the other 2 critical patients that I felt like were being a little overlooked or a little critical or really critical at that point, I would have given them to him because of his experience and his abilities to be able to care for these patients and not, once again, need too much assistance with what's going on. And I can just go behind him and check what's being done. Okay, my NAs, we're going to start with Charlie. Charlie just finished 6 months ago school orientation. He had the orientation 3 weeks ago, so I would have actually given him the patient Jason, because Jason needs a one-on-one supervision situation. He has a one-on-one supervision situation going on right now for suicide precautions, as you would have read in his report on the presentation. So I gave Charlie him because he's the least experienced, so he could help me, but it would be a little bit more me needing to kind of like go behind him and really help him with some things that are going on because of the fact that he's new. And so my other staff members, the other 2 CNAs, I just kind of split the patients up between the 2 based off of the skills they're able to do. So since Frances is a NA2, I allowed her to have patients that were under her scope of practice, so things that she could assist with under her scope of practice, as well as Shelby. Shelby's very experienced, so I kind of gave her patients that would be under her scope of practice, but they may have been a little worse off, and she could handle them a little better because of her scope of practice. She is not scope of practice, I'm sorry, but because of her experience. Okay, so coming off of that, let's talk about what is professionalism. Professionalism is not only the attitude that a person presents with or their uniform being worn right, but it's also the person's integrity, their leadership, their ability to work as a team, communicate. So that being said, with everything going on in this presentation, there's a lot of need for communication by the charge nurses, a lot of need to lead and work with a team well. So we use all these skills to help us in better communicating with people going on around us, and they're relying on the fact that you are being truthful and honest when you're working with them, and that you know what you're talking about and you're confident in what you're doing. So this all is basically professionalism, and it leads into professional nursing or being a professional nurse in general. So that being said, I am the charge nurse, so I have to show my leadership in this sense. I would have decided based off of the staff members I was given and the patients I was given what type of nursing system I would want to use. And in this instance, I think I would want to use total primary nursing care as a delivery care system, because it allows me to assign the nurse to a group of patients and then be responsible for those patients. And because we have so many critical conditions going on, I really want to make sure each patient is properly taken care of and properly paid attention to, because their condition can once again change really quickly, and be able to oversee that. So that was the best option I chose for being able to oversee what's going on. So now let's talk about my patients and what is going on with my patients and the new orders I would give for my patients and how I would do the orders that are already currently being addressed for my patients. Okay, so now we're going to talk about the tasks that need to be completed for the charge nurse's patients, which is my patients. And the first patient I gave myself was Jeffro. Real quick, so Jeffro, once again, had severe pneumonia and was recovering and came to our unit from ICU the night before. The issue I have going on with Jeffro, I would first, let's just talk about basically we're going to put our task and the things we're going to do that day in order based on his condition, his diagnosis, and stability. That being said, first thing I would refer to is his chart and just reading over everything, because from the report I got, it seems like he may need to be sedated because he's still experiencing labored breathing, uneven. He's cyanotic, he's pale, extremely anxious despite medication receiving. That's the key. And he also is having severe pain despite medication being received as well. So I think this patient, because he has severe anxiety and his pain level is still pretty intense, his order calls for morphine every 6 hours for pain greater than 5. Right now he's experiencing pain of 10 out of a 1 out of 10 scale. He's also supposed to receive Ativan 1 milligram every 4 hours for anxiety. And once again, his chart is saying that he is not experiencing relief from that medication. This makes it a little difficult because of the fact that he is a nicotine abuser and a cocaine abuser. But before we even address any of that, we need to address his oxygen and what's going on there, because he's still 90%, as oxygen saturation is 90%. And I feel like with unlabored breathing, increased respirations, anxiousness, all that mixed together, it's really causing some issues for him. So we need to first go in there and assess him to see what's going on. So I would first go and assess the tubes, the lines, see if there's any kinks, anything happening. I would call respiratory therapy, and just ask him to come up to make sure there's nothing wrong with the device and why he's having an issue with breathing, or why he's not getting any relief, it seems like, from the machine. At that point, I would then contact the doctor, because it also states as an order to wean him off the ventilator as able, but I don't think he is able to do that. So I think we're going to call the doctor at that point and say, hey, look, he is having issues with his anxiety and he's still having issues with pain. Very high pain level 10, anxiety intense. So at that point, I think he just needs to be sedated, put to sleep, and allow his body to heal that way, because with him awake and not being able to talk because of the ventilator, I think it's making him extremely anxious, and that medication is not helping. So that's probably like 2 or 3 of the orders, and I would start with those 2 immediately, because oxygenation is important, and as well as pain management is important. So those are 2 things I would start with first when I, see my patient, because of his diagnosis and the condition he's in at the moment. When I came in, says that he needs a little bit more assistance. I would think an order for sedation would be good. Also, once the issue is resolved and he is in a better state, I would then ask my nurse, not my nurse, my NA, to do his vitals and his ADLs for the day. And I would, if he is sedated, then of course I can't check with him, so I would just, go behind her and just make sure everything's good in the room, because you still should be doing hourly checks anyway on your patient. So I would still make sure everything's good and everything was completed, and checking her charting to make sure everything's completed as a supervision of the task I delegated. Then after that, I would start, after we did the ventilation and pain medication, I would start the normal saline for 15 mLs an hour. We went ahead and started that. And once you get everything fixed on the machine, at that point is probably when I would start doing the suctioning and getting all that cleared up. And I would probably delegate that to my CNA as well. Since she's a CNA too, it makes it a little bit easier, because she can help with more tasks. So I would probably delegate that as well. If not, I would do it myself before leaving out the patient's room. And then his repeat pneumonia scan for the day would probably be the last task that I would get done. But on the slide what I have listed is the new things I would have done for the patient, seeing how he was having issues before I came in. Okay, so now we're going to go to my next patient, who is Jenny. Okay, Jenny is another patient that I have, like I said, and I'm not going to jump too far into her chart because of the fact of, I read it earlier. But she currently had a severe convoluted fracture to her left femur. Her condition is very concerning. This is, once again, why I gave myself her, because of the fact of her current vitals and the current pain level, sweating, bluish and coldness to her legs and toes, and she's not getting any pain relief from her doses of morphine. And she doesn't have a history of drug or alcohol or anything, or nicotine abuse or cocaine abuse like Jeffro did. Jeffro was different because his situation, he of course had addictions, which causes an issue with the medication, because now it's going to cause, we're going to have to give you more to help with the pain compared to a normal patient where we wouldn't have to do that. So the issue with her is that she doesn't have that issue, but she came in with a fracture from a physical fight that she had with her wife, which kind of doesn't have anything to do with what's going on at the moment, but we're going to get to that in a second, because that'd be the second thing I would add to my orders. So right now the order she has is for pain medication, of course. She also has performance against for pain medication for greater than 6. She's already received pain medication and it's not working. Supposed to monitor or give PRN for any breakthrough pains. She's supposed to be NPO after midnight because she's going to have surgical repair in the morning. And she needs to be on Buck's traction to left leg at 10 pounds. Also, she's supposed to be given Levitrol, 50 milligrams, for systolic pressure greater than 150, and oxygen administered PRN for saturation greater than 93%, to keep them greater than 93%. So those are her current orders right now. Issues that she's having, or I'm having, with her chart is the fact that, once again, bluish, cold leg, toes, as well as the sweating, complaining of pain after even being administered medication. And the key of the whole chart is that she was applied a cast to stabilize unit for surgery that's scheduled for tomorrow morning. Okay, so all those things mixed together kind of leads me to believe that the patient has compartment syndrome, because, like I said, all the issues that she's having, and the non-relieved pain, the sweating, bluish and cold feet, toes, that's really suggesting that the cast was either put on too soon and it caused compartment syndrome, or there may be a cutoff there, a blood supply. But the unrelieved pain makes me think it's compartment syndrome. So I would once again go in and assess her first, just to confirm what I think. And then I would call her doctor immediately, because there's no point in administering pain medication and all that if she's not getting relief from it, because that means there's something else going on. So I'll call her doctor immediately to inform that I think the patient has compartment syndrome, and they may need surgery immediately now, or we need to take the cast off. One of the two. The bluish cold toes, it's not okay, or even the uncontrolled pain the pain level. Also, the increased BP, tachycardia suggests she's in intense pain. So, yeah, definitely with her, I would do that first. Once I did that, then if she is still having issues with that BP, because sometimes pain can cause your blood pressure to increase and your heart rate to increase. So she's still having issues with her systolic blood pressure at that point, then I would give the medication for her systolic. That'd be probably the second order I would follow up with, because as it relates to her condition, safety, circulation first. So we handle the circulation issue, got that done, and then I'll give medication. And that would dictate what if the doctor says, hey, we're going to go to surgery ASAP, Or if he says, no, we're not. If he says not, then we're then going to go ahead and do the traction and get her ready for the surgery that's going to be done in the morning. Put her as PRN, all that after we have checked her vitals. I would have her nurse, my CNA, check her vitals to make sure she's okay. ADLs, vitals and everything to make sure they're done. And ADLs, and I'll check behind her by checking her charting, asking the patient, excuse me, because she's conscious at that point. So I would ask the patient as well, and I would check her charting, double check behind her to make sure it's done. And after that, she's ready for surgery. We get into morning shift, getting her ready for surgery. She's good. We'll get her straight for surgery. But if she has surgery that night, of course, I prepare to get ready for surgery that night. But once we've done surgery, she's out of woods with all that, I would then probably put in a consult to see if she wants to speak to a counselor or anything like that, because of the fact of this physical altercation. So even though there are 2 women married, it says in her chart, I feel like domestic violence doesn't have a gender to it. So that was something I would definitely address, because it was a physical altercation with her wife. So now she's having to go back home to this person, if she plans on going back home to this person. And I just want to make sure at that point that the patient is safe or has a safe place to go home to, or even if she wants to go back home to that person. And at that point, she needs to talk to a counselor if she feels like she needs to talk to a counselor. If she denies it, then there's nothing more I can do. But if she wants to press charges, then that's something we need to call the police for and get them up there and kind of do everything we need to do there. So yeah, that's basically it from those 2 patients. And basically all that's, I just did it in the order that as their condition was presented to me and their diagnosis was presented to me, and their stability is when I came in there and seen them. Of course, I always do your assessment first, but then it goes A, B, C's at that point. So airway, breathing, circulation. And both my patients had one major one first. So those are the things I would definitely deal with first. Then I would handle that pain. So that's basically it for these 2. And now let's just actually talk about professional nursing in general. So we talked about before, what is professionalism and, how it relates to what's going on here. In this situation, professionalism played a big role, because I had to speak a lot for my patient. I speak up a lot for my patient, and I had to, both patients actually, and I had to really, because of the things that were not missed, but the increasing in conditions that were going on, I had to really advocate for my patient and be confident in what I'm saying, and know that sometimes the doctors aren't going to see everything. You're the second eye for the doctors. So they're trusting you to be professional nurses and come to them and and tell them what's going on with your patient, because you're the second eyes. So some stuff they're not going to see, or some stuff they miss, and you have to be bold enough and basically bold enough and just basically comfortable in your abilities as a nurse to know what's going on, know when something's wrong, and advocate for your patient, tell your doctor. And if he doesn't do anything about it, tell the charge nurse, but I am the charge nurse, so I will go to the next person in line after that if he doesn't do anything about it. But professionalism plays a big role in nursing in general, and specifically, and really big in this scenario. Okay, so how does time management relate in nursing? Basically, what does it mean to nursing? Time management refers to how one's use of their time throughout their shift to complete tasks that are assigned to them at the beginning of the shift, of course. As a nurse, it is important to use every second of your day wisely, as your day can easily be shifted and changed. If you aren't managing your time wisely, you can easily get behind, and this is especially important for a charge nurse since they are responsible for all the patients and the staff on the floor. So basically, you could have an issue where a patient turns extremely critical, and now you're having to really constantly deal with that patient, and now you're missing stuff with your other patients because you didn't prioritize and manage your time wisely. So it's very important as a nurse to manage and understand that you can't do everything, so you have to delegate. Delegating allows for you to use the maximum amount of your time. You check behind the people you delegate, of course, because at the end of the day, these patients are your responsibility. So you have to make sure you check behind the patients not the patients, I'm sorry, the people you delegate to, even your staff members. So as a charge nurse, I have to check behind my staff members as well. So me delegating the work that I could delegate to my NAs, that allowed for me to have a little bit of free time to help the other nurses that need help, or just supervise and check behind what they've done. What's going on with your patient? Okay, what did you decide to do? Did you call the doctor? Or just check behind them and make sure everything is complete, because as a charge nurse, the whole unit is your responsibility. You're responsible for every nurse on that floor. So it's very important to make sure that you check behind them and conversate and manage your time wisely. And the only way you're able to do that is by managing your time wisely. So you have to start early with it. Start early, come early. Don't come right when you're supposed to be there, because it'll make it an issue trying to get yourself together for the day. So it's a big thing with time management. Like I said, it frees up time as a charge nurse to really check behind your staff members, make sure all the patients are okay. Right now I only had 8 on the floor, but if I had more, I really have to be paying attention to how I'm scheduling the day. Write it out and really pay attention to how I'm scheduling my day. Okay, tips for time management. Don't keep your phone on you. Minimize distractions. I would think you should put it in your locker. You can cut it off in your pocket, but I think it would be a little bit distraction to cut it back on, so I would put it in your locker. Goal set team, meaning review the patient's goals of care for the day and any goals you have for activities such as completing documentation, attending a patient care conference, giving handoff report, or preparing medications for administration. And time analyze. Reflect on how you use your time. While working in a clinical area, keep track of how you use your time in different activities. This provides valuable information to reveal how well organized you really are. Okay, priority setting. This is very important. Basically, you're going to set your day based on the priority of the patients that you have, like the things that they need done immediately, it cannot wait, things like that, in specific time frames when they're set. So if you have a patient that needs something done within a certain hour, it has to be done within a certain hour. You need to prioritize your other patient's care and also that patient's care to where it gives you time, or are able to complete the task in a time that's being asked. Interpretation, control. Everyone needs time to socialize. Basically, be human. Take like lunch breaks and just talk to your colleagues and things like that. Evaluation. At the end of each day, take time to think and reflect about how effectively you use your time. If you are having difficulties, or discuss them with an instructor or another experienced staff member, to see how you can better organize your day to complete the task you're asked to complete. Okay, so let's tie everything together. Professionalism and time management as they relate to each other. Professionalism and time management in nursing works hand in hand. It is important to have the right attitude when directing staff, or they will rebel against the nurse's authority. So as a charge nurse, it's very important for you to use professionalism when directing or talking to your clients and to your staff, because it can really cause an issue in the work area if you don't. You can't be rude to the patients, because then they won't really do the task you're asking them to do, especially if you're trying to complete it in a certain amount of time. So it's very important to always be professional when handling patients as well as staff. It makes it a lot harder to do assignments. It makes it a lot harder to manage your schedule all of that. It really messes with your time management when you are not professional, and vice versa. It messes with your time management. Time management can mess with your professionalism, because now you're not a person of your word. If you say I'm going to be in here in 30 minutes to give medication, you need to be in there 30 minutes to give medication. So it really, they both tie hand in hand. And with my patients, it is important to use both of them when doing, just to optimize the amount of time I have and optimize care that's being given to the patient. And once again, it messes with each other, because if I'm saying I need to be in there a certain time, or I'm telling them I'm going to be in there a certain time, or something's going to get done and I don't do it, it just depletes my integrity with the patient, so as well as the staff. So it's very important to be professional and manage your time wisely. They both go together when you're talking about nursing or any profession, really, to be honest. All right, guys, so we're at the end of this presentation. And basically, I just want to leave everyone with, as a nurse, once again, being professional and manage your time wisely is a huge part of the nursing field. You have to be on top of you as a nurse, your ability to communicate, your ability to be flexible, work with others well, communicate well, and be a leader, and your personal skills in general, and just your integrity. It really speaks to volumes when you're dealing with patients and when you're dealing with your staff members. Time management is also a part of professionalism, so you have to manage your time well as a nurse. And I think we put that together real well in this scenario. And that would be all. Thank you, guys.